care is built. It's where staff feels valued, empowered, and supported to provide compassionate care. Well, different research have shown different points, but it improves patient care satisfaction and experience, enhances staff engagement, reduces medical errors and safety risk, and foster innovations and continuous improvement. The challenges are immense. Let me have the privilege of calling on stage Dr. Parag, who would be talking on building a positive workplace culture for enhancing patient experience and safety. Dr. Parag.
A very good afternoon, ladies and gentlemen. And before I begin, let me just announce that there is going to be a very fiery debate in the afternoon. And to that end, I'd like to start by saying that this conversation that just happened, at no point in time did they have any analogy or correlation of accreditation standards with patient experience. So to my learned opponents, Dr. Malti Archana Pallai and to Dr. Sanjeev Singh, who are going to be fighting, it's already proven that there is really no correlation, but that's on a lighter note. Ladies and gentlemen, thank you very much for the invitation. I missed last year's conference and it was my bad, but let's just talk about building a workplace culture for enhancing patient experience and safety. Fundamentally, what is a positive workplace culture? Let's just understand that. And by the way, just for your information, those of you who feel that you're going to get some gyan from this, all these slides are made on ChatGPT version 3.5. The slides are available. What is going to be interesting is some of the inputs that we are going to discuss with you throughout this next, there is no timer, so I guess I have 2-3 hours to speak. What is important is going to be the amount of inputs that we are going to give on how we are actually doing it. So basically, it's a work environment where staff feel respected, where a doctor is not able to scream at a nurse because something went wrong with the patient without finding out what is the root cause. It is a work environment where staff feel valued, not just to the extent of their salary, but to the extent of being in the organization, of giving 8 to 10 hours, okay? Where staff feels supported. When they have a problem, somebody picks up the phone and said, hey, I heard your mom had a stroke, is she okay? That is a positive work environment. All of this naturally will foster teamwork. All of this is going to foster better communication. And as Dr. Umar just said, communication, bad communication is the bane of everything that goes wrong in healthcare today and actually everywhere. You must have read recently about the aircraft that went in the opposite side of the runway. Now, we all have learned from aviation. It's time we learned about these things also. I think what is most important is that a positive workplace culture must have a shared commitment to excellence. And believe you me, it begins at the top. I had the privilege of meeting Gupta sir about 11 years ago. I don't know whether he recalls, but I distinctly recall. He said, I want to build a chain of hospitals which over time will have nothing but the patient at its heart. Now, when you have such leadership espousing these clear thoughts, the positive work culture is bound to grow slowly, steadily, but it will happen. Let's understand why it is important. One, there is an impact on patient experience. If there is a laissez-faire attitude of leadership, if there's a theek hai, chalta hai, let it happen kind of a attitude, then that is definitely going to impact patient experience. It's going to impact patient safety because you're not going to listen to what your committees are saying. Your committees are going to come, meet tea and go. And that's not going to help. And I think what is extremely important is it's going to have a vitiated work environment. The reason why today government hospitals are poo-pah'd at and privates are supposed to be the great thing is because essentially there is an endeavor to try and produce a positive work culture. The non-punitive thing that we keep talking about is something that private institutions actually inculcate from day one. Not so successfully in some chains, greatly successful in some chains. But what is important is that we need to get this non-punitive thing in our blood once and for all. You know, W. Edwards Deming has said that all mistakes belong to the system and the system belongs to management. So in India, we've got this whole thing about saying system ही खराब है. System हम ही ने बनाया है, हमारे ही नेताओं ने बनाया है. So when we point a finger at the system, we are pointing 3 fingers to ourselves. And that is why we must understand the non-punitiveness of the culture is extremely relevant to fostering a positive workplace environment. Now, why does it matter now? Because there is increasing focus on safety, on patient-centered care, and sooner rather than later, the government has already moved and the private healthcare institutions will be forced by insurance to move to DRG-based payment. So the patient paying for his healthcare associated infection is not going to happen. You will not get the money for a healthcare associate. You will not get the money for a fall. So that's something that you need to think of. Some issue with my... can you hear me, guys? Yes. So that experience at least is decent. Okay. Employee satisfaction. Today, with the pace of growth of healthcare, we don't have the people. We were looking recently for some senior managers and we interviewed people who didn't know nada. So it's very important that you retain your people who worked with you for 10 years, 12 years, 15 years. And that's why a positive work culture, a positive work environment becomes very, very important. Staff must feel motivated to come the extra day. COVID was a classic example of determining who are the boys and who are the men. A lot of hospitals shut down. But the hospitals that had managed to create a positive workforce culture succeeded because people were willing to stretch. And that is where this matters. At the end of the day, we always talk about what we call the triple bottom line. People, planet, and profit. I always believe that if you take care of the people and you take care of the planet, the profits will come. We are not here to make an indecent amount of profit. We are here to make a good, sustainable profit. And I think that's fine. Okay, I have Gujarati blood in my veins and arteries, and therefore I'm a little more focused towards profit. But I'm also focused on people because I know if I don't invest in people, I'm not going to make money. Unfortunately, the brunt of all of this is borne by our nurses who to date have not realized that they are a professional body, they are professionally qualified people, and they need to stand up for themselves. Okay, I'm just going to skip. I'm going to share these slides with you and I'm going to come to what I wanted to tell you. Communication is one of the most important things. And let me tell you how communication has to flow down in terms of actual top management commitment. Everybody says walk the talk, walk the talk. Now let's say, for example, the CEO of the hospital is walking into the main lobby at 9 o'clock in the morning. And if the attendant in the lift is going to usher out patients because sahab aaye hain, that's not a very great culture. But if the CEO or the CEO is going to step off the lift because there is a patient who needs to get in, that is a positive workforce culture. When you allow a nurse to get in because she's got to go on duty faster and otherwise the bus to the hostel will go back late, that is something which you are inculcating, walking the talk as managers of today, as CEOs, CXOs of today, and that is something that you need to do. I remember a time when we had a consultant physician insult a nurse for something that was actually nobody's fault. It was not his fault, it was not her fault, and let's not get into gender here. What happened was that I happened to be the medical director and I requested him, sir, you need to communicate an apology or at least accept that you are wrong. गुजराती में हमारी एक कहावत है which I'll translate freely, नमे सो प्रभु ने गमे, जो झुकता है वो प्रभु को पसंद आता है. इसलिए तो जब हम प्रभु के घर पे जाते हैं तब हम सब झुक के जाते हैं ना. So the consultant said, I will go and apologize because I was irritated at something. I said, sir, to maintain your dignity, I will pass on your apology. And the chief of nursing said, I accept. And the nurse said, I accept. But this is exactly what it means by having communication which is equal on both sides, which does not really differentiate between people based on the BMWs they own or the metros that they come by. And I think this is a message which nurses of today, which managers of today, I see a lot of young faces here. As you go forward, remember that in today's day and age, nobody is above the law. Nobody is above getting pulled up in front of a grievance redressal committee. And today it happens more often than not that seniors get pulled up. When we take feedback, when we take a 360-degree feedback about ourselves from our peers, our juniors, our superiors, often we get feedback that you are not nice to people. And when you think back, you realize that am I as a CEO inculcating having a positive workforce culture creation in my organization. The other thing which will come to is the fact that if we ourselves don't believe that if we believe that we need to do quality only in the days of accreditation, that's the message that we send out. So the nurses on the floor are not going to look at the 2 identifiers required before giving a medication and so on and so forth. So I think that the culture, the positive workforce culture, is something that sets in not only on a good morning, good evening kind of a namaste kind of a routine, but also in the way you discuss things, the way. The other thing is, which we have lost, is because we are all people. We don't say that you listen and have a darbar every day, okay, like Akbar and Birbal and stuff. But when there is a need, when there is a grievance, when there is a specific opportunity where you need to give gyan or take gyan, I think you need to listen very carefully. Success is measured in various ways, but there aren't too many metrics of measuring culture. We, for example, use the ARC system of measuring healthcare safety and healthcare safe culture kind of a thing, but that doesn't really help. What we can look at is patient satisfaction scores, employee engagement surveys, and safety incident reports, also feedback which comes from time to time. Action plan for leaders. There are 5 points, you can read it later, but according to me, the action points are very, very simple. First of all, identify कि आप कौन हैं. Are you an extremely profiteering organization which doesn't mind doing unethical practices like double billing, etc.? Or are you an organization that wants to make a decent profit? You're committed to really serving the poor, weak and needy? That is something that you need to decide. Once you've decided that, then you need to decide what is going to be the culture of the organization. To my mind, a positive workforce culture is one that keeps the patient at the center. When I started a hospital in 2014, as you know, we all pick up nurses, nurse managers, doctors from various hospitals. One of the first things that we did is we sat down, and unfortunately for me, this is not to elicit any sympathy, but unfortunately for me, just about the time that I started the hospital, I lost my father after having spent about 8 weeks in an ICU. So I had seen the other side of what patient relatives go through. The patient was on the ICU bed, ventilated, nothing much to be done. But what the relative feels is something that I had known. So the first thing I asked my nurse managers, let's sit down and identify reasons as to why do we need registers. Are you not going to issue a duplicate lab report? Are you not going to issue a medication that is broken by somebody? You may bill it, you may recover it, but stop register culture in this country. ये जो ब्रिटिशों ने हमको दे के गए ना सब जगह document, we need to rethink about how much of it is really required. Because usually we are focusing less on the patient and more on the documentation part. And again, we will discuss it, but even when you are going in for accreditation, there are simpler ways of documenting, there are simpler ways of demonstrating what you have done. Once you've identified who you are, then you're going to identify how you're going to spread that in the organization. And I think the first and most important thing is not having airs about who you are in terms of a person. You may be the CEO, you may be the manager, you may be anybody in the organization, but saying a simple good morning, and especially if you remember the girl who cleans the porch in the morning and say, Namaste Savita Didi, kashi hai, how are you? It kills all barriers of any negative messaging that can go out. Being positive in your own outlook, being positive towards people, being positive and remembering that the patient is the center of your universe as a healthcare institution, that is the one and only way in which you can build a positive workforce culture. With that, thank you very much. I've just about come to the end of my time. Thank you very much.
Thank you so much, sir. And may I request Dr. Rakesh Gupta to please come on stage to felicitate Dr. Parag Rindani. I think he brought out some really brownie points as to how we should be encouraging a positive culture in our institutions. Sir, can we...